My name is Dr. Jonathan Stein, and I am the Lab Director and Chief Science Officer of SpectraCell Laboratories. The reason we're recording this is because we're very excited to announce that we are offering COVID-19 antibody testing. And in the course of that, obviously, people have a lot of questions about it, and I thought we could try to address some of them here and now. So first off, SpectraCell Diagnostic Laboratories, we're a clinical diagnostic laboratory. We're CLIA accredited. We've been around for something on the order of 30 years. We do high complexity laboratory testing. And probably the important piece about this is we've, for the last 30 years or so, been offering tests of immunoassays, testing for nutrition and how it impacts immune health. So we have quite a bit of background in the immune system. So hopefully that'll be helpful here. Real briefly, you'll hear a lot of words bandied about, and you may have questions about whether which name applies to which thing. But very briefly, the COVID-19, the virus, is currently from the family of viruses known as Coronaviridae because they are crown-shaped. Corona just means crown. The virus itself, the technical term we will be using for this talk and is kind of in general circulation, is SARS-CoV-2, the severe acute respiratory system syndrome caused by the coronavirus 2. And then the disease itself is called COVID-19. And you'll hear the last two kind of used interchangeably. But one is the disease and one is the virus. So very briefly, the COVID-19 appears to have first appeared in China in late 2019. The index case in the US was in January 2020 in Seattle, and sequence analysis of it strongly suggests a natural origin. That's from a Nature paper from last month, from April. Moving right along, there's sort of two things to consider about viruses: how contagious it is and how deadly it is. Obviously, for this one, it's going to be different in different populations because there's different behaviors, and also, some people shake hands, some people bow, some people kiss each other's cheeks culturally, and obviously that's going to change the rate at which a virus is infected. Mass transit versus using private cars and so forth. Anyhow, the estimates for the fatality rate vary. Again, it depends on how it's calculated, and it depends on the risk population that you're looking at. But it's generally low, less than 1% for healthy people. It's known to increase with age and underlying health issues, and it's also increased when the healthcare system gets overwhelmed. So that's kind of the long and short of that. It's highly contagious. So that's really the thing that's needed to be known. Why get antibody testing? Well, people would like to know if they've got it already, because from some studies, 98% of people who have it are asymptomatic. So we know this thing's highly infectious, and we know lots and lots of people who get it will never show any symptoms. So it would be good to know if you've already had it. So you don't have to be concerned about getting it, and you may have some resistance to either being infected or being reinfected. So there'd be a tremendous amount of peace of mind. Antibodies are produced by special immune systems, and so once you have the correct antibodies to it, your body should be able to more effectively fight it off. So there's a process to this. The infection process is essentially this. You get infected by a virus. After about 5 to 7 days, your body starts producing different antibodies. The earliest ones, IgM, will start the initial fight, and then they will direct your body to start producing IgG, sort of these secondary antibodies, and they will give you some resistance to it moving forward. So we were going to test for both of these. Both the early onset of immune response and then the long-term immune response. There's a difference between the screening tests being done and the antibody tests. The nucleic acid testing or the molecular test, they'll take a nasal or pharyngeal swab and sometimes called a brain tickler because it goes way, way up in your nostrils to get a sample. And then that looks for actual viral RNA within that epithelial tissue from that swab. And it's screening for a current infection. It's a little tricky to do. Nobody really likes getting a nasopharyngeal swab, typically. The antibody test is much more straightforward. It's a medium to high complexity test. Both of these tests are fairly complicated in terms of the interpretation, but the antibody test is fairly straightforward. It's a simple blood draw from peripheral blood. They'll do a needle stick either in your arm, or some folks will be doing finger pricks depending on the availability of arteries or veins. And then from there, it's a blood test, and it looks for the presence of antibodies to the virus. It's a little bit different. Here's the possible test outcomes from the antibody test. If you're negative for both the early antibody and the late terminal antibody, there's two possibilities. One is that you haven't yet been infected with the disease, or you haven't yet produced antibodies in response to the virus. So some people who might be immunocompromised might have the virus in them, but they wouldn't show sufficient antibodies to show up on the test. Or you could be very, very, very early in the infection, typically prior to symptoms, and you wouldn't have an immune response. If you've got the early antibody, or IgM, that suggests you're very early in the infection stage. If you've got both, you're in the active phase of the infection, but your body is starting to produce long-term antibodies. And if you are IgM negative but IgM positive, then you're either at the tail end of a current infection, or you have already kind of beaten the virus, and now your body is producing these long-term antibodies. It's worth saying I get a handful of questions every day about clinical treatment, but we are a diagnostic lab, not healthcare providers. So there's this little thing called practicing medicine without a license. We are licensed to perform diagnostic testing, but clinical treatment options have to be discussed with your doctor or your primary healthcare provider. So we can offer testing as a laboratory, that's what we do, but in almost all circumstances, you'll need to take those results to your doctor to discuss treatment options. It's also an important disclaimer that antibody results should not be used as the sole basis for treatment decisions. You'll discuss that with your clinician. We also have some educational materials online on our webpage. You can see that in the lower left corner at www.SpectraCell.com. So if you want to see what materials we have posted, they're right there. So if you want to purchase the test, you can go to our website, www.SpectraCell.com/antibody test, and that'll get you the information to get the ball rolling. And just want to close with the idea that he who has health has hope, and he who has hope has everything. We hope this information has been useful for you, and we hope to hear from you soon. Take care. Be safe, guys.